Prior to asking our witnesses to speak, parties should take note that our next anticipated meeting is on Tuesday afternoon. However, as you know, we may anticipate a voting marathon on Tuesday afternoon or evening, or Wednesday afternoon or evening, and Thursday afternoon, morning, afternoon, or evening. And so keep an eye on whether we are actually going to be meeting on Tuesday and or Thursday. So with that, I'm just going to invite Dr. Ferguson, Associate Professor, University of Manitoba, to give his 5-minute opening statement, to be followed by Dr. Sauvé, Université de Montréal, and Dr. Fei-Yun Wang, University of Manitoba. Gentlemen, I look forward to what all these university professors have to say about contaminated sites. With that, Dr. Ferguson.
All right, well, thank you very much, everybody. Good morning. My name is Dr. Philip Ferguson. My colleague, Dr. Fei Wang, will read a treaty acknowledgement, so I'll leave that to him a little bit later. I am a professional engineer in the field of aerospace systems and an associate professor in the Department of Mechanical Engineering at the Price Faculty of Engineering, University of Manitoba. My research explores how to make aerospace technology more accessible to communities in Canada. Specifically, I study aerospace remote sensing and guidance systems on drones, airships, and satellites in co-development with northern Indigenous communities in Canada, such as Chesterfield Inlet, Nunavut, and Churchill, Manitoba. I'm happy to answer any questions I can on this topic to the extent that I can, given my area of expertise. Thank you.
That's very efficient. Gee. With that, we'll call on Dr. Sauvé.
All right. Bonjour.
Good morning. My name is Sébastien Sauvé. I'm not sure I can be quite as efficient as my colleague, but I'll try my best. I'm a professor of environmental chemistry at the University of Montreal, Université de Montréal. I work on contaminants in the environment, legacy contaminants such as lead or cadmium, but mainly emerging contaminants such as pharmaceuticals, hormones, pesticides, plastics, and at the moment, principally on PFAS, also called forever chemicals. PFAS, polyfluoride substances, are carcinogenic substances which cause cholesterol problems, reduce the response to vaccines, and are suspected of affecting the liver, kidneys, and thyroid. Quality criteria for PFAS in water are constantly evolving worldwide, but for the time being, despite Health Canada's recommendations, they are not really regulated in Canada. In my research, I track PFAS in water, in fish, food, sewage sludge, and the environment in general. I assume that my experience around the Bagotville military base will be of more interest to the work of this committee, and which is why the committee invited me. We carry out water analyses using a rather original procedure. We travel around and sample publicly accessible water points. They could be water fountains in parks and libraries, public toilets and restaurants or convenience stores. So we stop, we take a sample in the toilet, and we leave and we move on to the next city or town. Obviously, I could also work with cities to ask for permission and have a representative sample sent by the city. But as you would understand, if I were still doing that, I would still be buried in paperwork and trying to get the permissions and authorizations, and I wouldn't have been able to move forward. So I take publicly available water, and that's what I analyze. Through this work, we've identified 5 or 6 Quebec cities where there are issues in contamination of drinking water or other water. We saw that there's a very high contamination problem in the drinking water from the aqueduct at La Baie, which is about 10 kilometers from the Bagotville military base. Our analyses in my laboratory and by the Quebec Ministry of the Environment confirmed, and I think also by other federal organizations, confirmed that the water table somewhere between Bagotville and La Baie over about 10 kilometers appears to be contaminated. So regardless of where you take the sample, many of these sample spots show that the water table is contaminated. So I first informed the Quebec Ministry of the Environment, which is responsible for this sort of event, and then very quickly I realized that all of these people in different organizations don't always talk to each other. We'd like them to talk more, so I advised Health Canada, Department of National Defence. I thought they might be interested in knowing this, and the City of Saguenay. They were given a few months advance notice before it came out in public, but they did not deem it necessary to inform anybody. So the question is, why is it a chemistry professor's work that identifies a drinking water system contaminated by a military base? Thank you.
5 minutes, please.
Thanks, Mr. Chairman. Thanks to the honorable members of the House of Commons Steering Committee on National Defense for inviting me to share my perspectives. My name is Dr. Fei Wang. I'm a professor and a Canada Research Chair, Tier 1 in Arctic Environmental Chemistry at the University of Manitoba. I lead the new Churchill Marine Observatory located in Churchill, Manitoba, which was officially opened in August this year. Some of you probably heard that, so thanks again for the support of the government. I'm also Associate Dean Research of the Rideau Faculty of Environment, Earth, and Resources at the University of Manitoba. So I just want to acknowledge that we're here meeting at the unceded traditional territory of Algonquin Anishinaabe Nation. Just a little bit about my own background. I'm an environmental chemist, and I study contaminants in the environment, especially in Arctic and Northern Canada. It might sound counterintuitively, but despite its remoteness of location, Arctic and Northern Canada receives more than its fair share of many contaminants, either transported from the south or from local sources, such as mining and, I guess in this case, military operations. The contaminants that I study the most are legacy contaminants. So those are the ones that are primarily used in the past. The one that I study the most is mercury, as well as emerging Arctic contaminants such as microplastics, and increasingly we worry about oil spills. My research addresses the sources of these contaminants, their movement, their change in the air, snow, ice, and waters, the risk to the health of ecosystems and humans, and of course, ultimately, what we can do to reduce and mitigate the risk. So from that background, it should not come as a surprise that I would call your special attention to Department of National Defense and Canadian Armed Forces contaminated sites in Northern and Arctic Canada. One location I work the most is Churchill, and many of you would know that Churchill has seen extensive rocket launching activities by the US Army and the Canadian government from the 1950s to 1980s. There are, of course, many distant early warning line stations throughout the Arctic. And, of course, in addition, there are ongoing military operations across Northern and Arctic Canada. Contaminant sites in Northern and Arctic Canada are of particular concern for several reasons. Very first thing is the northern environment is highly vulnerable. Those sites are located in remote and often culturally and ecologically sensitive and vulnerable regions. And also, because of the remoteness, they tend to be forgotten. They were poorly documented and even poorly monitored. And they're also long-lasting, given that the region is relatively lower temperature and covered with seasonal snow, ice, and sometimes perennial ice. The contaminants at those sites are more persistent, probably compared with in southern locations. And of course, one area that I study the most is the complication by climate change. So if you have contaminants in the environment with ongoing climate change, it makes things even more complicated in terms of the impact and how to mitigate that. But when I point out the challenge in Northern and Arctic Canada with respect to the sites, I also want to make the committee aware that in this country, we have great capacity to actually address those issues. Many researchers in Canada, including myself, were global leaders when it comes to northern contaminants. And throughout the country, we have many state-of-the-art laboratories, of course, including from my colleague at the University of Montreal. And there are also a lot of research facilities in the South that could help. And of course, there's a network of Northern colleges and field stations in the North. And throughout decades of research, there's also extensive experience with knowledge co-development with indigenous and Northern communities. This is demonstrated by many community-based monitoring programs. So thanks for the opportunity to share my perspectives, and I'm happy to speak more to any of those points and beyond if there are questions. Thank you.
Thank you, Dr. Wang. 6-minute round, Mr. Allison.
Thank you very much, Mr. Chair, and to our guests, thank you for being here. Dr. Soe, I guess one of the things I've learned since I've been up here is that departments don't really speak to each other. You just alluded to that pretty well, and we haven't even added in municipal and provincial levels on top of that. Any thoughts? And that's a discussion for a whole other day. But your experience with that is any thoughts for us in terms of how we could do a better job of not being so siloed? And I'm talking, federally in terms of departments that don't necessarily talk to each other, based on your experiences.
It's a tough question. In my experience, has been more within the provincial level or where within what you would think would be friendly zones. The public health does not necessarily get the information that the environment gets, et cetera. And you get the same thing at the federal level. There's no easy solution, but maybe having centralized data might be a start where newly generated data is available for all government agencies. Might be one way of at least there's some forced sharing of information that would help in a case like this. Because usually the information has to be accessible, but it's hidden or it's not shared. So if someone knew that the report existed, they could get at it, but they just don't know. So I'm not sure which mechanism can break those silos. I don't think it's an easy task.
That's fair. And I guess along those lines of sharing information, I mean, certainly with AI and a number of things that are going on now, do you see that being a role? I mean, you talked about you physically were mapping out spots in terms of trying to figure out, do you think there's a role for AI then to try and come up with, some type of, this is what we expect things to how they're going to travel and move in a certain way?
In a case like this, I think the AI might be useful in collaging the data, getting the data together and making it easier to find the appropriate data. I think that's probably more where I would think. Some AI, I haven't done that yet, maybe I should, but might be useful in terms of predicting areas that would need to be sampled or where there's a higher risk of contamination. Because we did a fairly thorough sampling, but it's partly random. And there are areas of the countries that need to be sampled to see whether the drinking water is tainted or not. So maybe there are ways, there's definitely ways, I'm just not sure how, but there are definitely ways where AI can help better plan that sampling, because sampling is very expensive. And yes, the analysis in the lab are expensive. You need fancy instrument, but oftentimes, and it's probably even more true for my colleague, is getting out there and getting the samples back to the lab. That's very costly.
Do you have any comments on that, Mr.?
Yeah, I agree. I think on the AI side, analytically, there's a lot of room to play as well, especially when we talk about those emerging contaminants. There's just too many of them, right? We talk about the thousands, tens of thousands, even hundreds of thousands when it comes to PFAS alone, for example. So often, the traditional way of doing this analysis, one compound at a time, it simply doesn't cut it. So with AI, there's definitely room to play. AI will play a role in terms of not necessarily identify individual compound, but a group of compounds. So ultimately, when it comes to effects to risk reduction, that might actually play a lot of role there.
And also as it relates to those that have obviously been affected by it. So maybe what they could be expected, based on the contaminant, what it could be expected to find in humans, and possibly.
Yes, I think that's especially the case when you're trying to pinpoint what chemicals, right? If we think about the health impact experienced by staff or by community members, often there's so many other complicating factors, not necessarily from that contaminated site, but there might be other explorer as well. So how do we actually dealing with this mixed explorer? So that's where I think that a lot of things AI potentially could play a major role.
Yeah, go ahead.
There's still some concern. AI will be trained by the existing data. So new emerging contaminants, new threats, something different, it won't see it. So yes, it's a tool, but it's not a magic solution either.
Minute left. So just further to that then, in terms of then help with diagnosis, I mean, if we understand what the contaminants are and what the challenges are, then I guess potentially over time, that would also help us when we're trying to maybe deal with our vets or people that have been affected by the contamination. They may also help drive the solutions in terms of how we fix that, right?
It could help in finding the most cost-efficient solutions. Because for some of those, there are different options to do the treatment and to remediate, and it's probably going to be very efficient. And well, in that situation, in that case, given the data that we know, this solution or this type of treatment should be more efficient. So I think in terms of matching conditions to treatment options, that might be actually a useful tool.
Okay, thank you.
Allison, Dr. Pawlowski, 6 minutes.
Professor Sauvé, you talked about contamination of the water supply between L'Abbaye and Bagotville. My understanding is that and that's with PFAS, right? Yeah, I don't think you said, but you were talking the concept of PFAS. My understanding is that PFAS are pretty ubiquitous. I remember the New York Times citing one study that seemed more like a meta-analysis, which seemed to find, as I recall, like 30 to 40% of water supplies have some PFAS in them. Do you think necessarily that this contamination was from the military site? Because you also, I think, mentioned 5 or 6 other cities in Quebec which also have some contamination, right?
Yes, in that work and the work that continued, we sampled a bit more than 500 sites or drinking water sources across Quebec, and 2 of those 500 were without any PFAS detected because our instrument was not good enough, I guess. But we have very good detection limits. So not being able to see PFAS is pretty rare. Within that data set of about 500, I guess the average is around 2 nanograms per liter for the sum of all PFAS detected. So at L'Abbaye, we were between 100 and 200 in the tap water or the wells. Some of the wells was up to 300. So there's no way that with an average of 2 and the 95th percentile in terms of distribution within that Quebec data set, the 95th was at 13. So if you got samples that are 100 or 200, it's not just random contamination. There's no way. So in that case, the assumption that it comes from the military base is an assumption we can't demonstrate unless we knew exactly what has been used in terms of foams. Basically, this would be coming from firefighting foams that would have been used at the airport or for some of the military exercises that have been done at Bagotville. And the pattern of the PFAS that we see in the water is compatible with being a residue from firefighting foam, but can't prove it.
Okay, so because my understanding is there are thousands of kinds of PFAS. So when you are looking at it, you do try to categorize that, and there are certain ones which are associated with firefighting foam. So you have a pretty good idea that that's where it came from, right?
There are thousands of different PFAS, but some of them are more theoretical, like you can imagine chemical Legos of how you can structure those PFAS. But we do measure 80 different PFAS, and we can look for 200 more. But we usually find between 15 and 35. We never find, because some of those are fairly rare and the concentrations are low. So usually on a contaminated sites, we'll find 30, 35, and then you get sort of a fingerprint in terms of the different concentration that we observe in that that fingerprint, and then you can see some are very high, some are slow. I've compared it to a fruit salad, and then if you get a fruit salad that has oranges and apples and blueberries, and you don't see blueberries very often, this is a strange apple fruit, salad. And then at some point, one fruit salad has a lot of cranberries, and you rarely see the cranberries, and you know something's funny. So this is an easy image, but that's a bit what we do when we're measuring 80 PFAS. And there's a peculiar signature in l'Abeille.
What's considered to be a dangerous level of PFAS? You've mentioned 2 to 3 in some areas, 100 to 200 around l'Abeille, Bagotville.
It's a tough question because that's why we say it's an emerging contaminant, because regulations across the world are not converging yet. In the United States, they have a very strong regulation now, and 2 specific PFAS from the legacy PFAS are regulated at 4. So PFOA and PFOS are regulated at 4, and there are 3 others that are regulated at 10. And Health Canada has a different approach where it uses a sum of 25 PFAS, and the sum of those 25 PFAS must be below 30. But Health Canada is a recommendation. It's not a true guideline as in the United States. And Europe has a similar guideline, but the summation for 20 PFAS should be below 100. It's a bit confusing, but the regulations are not entirely comparable. In the end, the U.S. ends up being a bit more severe and a bit more strict than the Canadian ones, but I think that what Health Canada is proposing is relatively safe.
So what are people in the area of l'Abeille, Bagotville doing to address this problem? Do you have to just drill new wells? Is there any way to treat your water?
The underground water is contaminated. If you build a new well, you're just going to tap the same water from a different well. I think that currently the city, initially minimized the issue and didn't recognize the problem. So he said that the water is safe to drink, but they did put in $12 million to treat the water. In the same message, they were saying you can drink the water safely, but we'll invest $12 million to treat it, just in case.
Thank you. We're going to have to, unfortunately, leave the answer there. We appreciate it. Monsieur Sauvé, 6 minutes, s'il vous plaît. Bienvenue au comité.
Merci.
Thank you. Not 12 million, 15 million, by the way.
Mr. Sauvé, I'm happy to meet you. I've heard you in various news reports and media reports in my region, Saguenay-Lac-Saint-Jean, because of the situation in l'Abeille. Could I review something with you? On July 11th, 2023,
Oui?
Yeah.
Est-ce que vous pouvez...
could you not do that on my time?
No, go ahead. I've stopped the clock. Don't worry about it. Okay, are we good to go? We're good, yeah.
Okay, let's continue. Thank you. The information was made public on July the 11th, 2023. I know that because myself and my party leader, François Blanchette, made the information public. I would like to know when you gave that information to the federal government. I would say that the previous summer of 2022, I advised Quebec's Department of the Environment, and I'd have to see exactly in my appointment book, but it was around Christmas 2022 or January 2023. I met with Health Canada and with National Defence. So Health Canada and National Defence knew this between December 2022 and January 2023, which was what you said in the media. You talked about October 2022 that you would have informed the Quebec government, and that you informed in early 2023 the federal government. So how is it that from early 2023 until July had to go by? That's a long time before the government deemed it appropriate to inform the people, there are 8,000 residents in the l'Abeille area. And you've already said publicly, I would not drink l'Abeille water personally. So how do you explain this lag of over 6 months before the population was informed? Well, there are two different elements that are mixed up here. In the summer of 2022, when I informed the Department of the Environment, I told them that the concentration of PFAS in La Baie was abnormally high. This wasn't in the paper that was already published, so I knew I was going to be working on a paper that was going to be published, that should be published soon. But I wanted to inform them because this was a public health issue. But at that time, the quality criteria in the U.S. and the Health Canada recommendations had not yet been published. So we were in a situation where we have a system of aqueducts which are more polluted than others, but we have no thresholds to compare them to anything and to tell us that this is catastrophic. But the information was published in February and March of 2023. So the minute that Health Canada was making a recommendation with that 30 level standard that I explained earlier, and the U.S. was talking about 4, we were saying, okay, well, then we've got a site here that goes beyond the Health Canada norms. So a significant time passed. Well, between the time where they had the information, we were above Health Canada's norms, and then at that point, the population was not informed. I assume the government took this seriously because it allocated $15.5 million for a temporary solution. I believe that it's impossible to completely clean up water tables affected. You have to find other sources of water for that population. Technically, it's probably possible. You could do what we call pump and treat, but the cost of doing that is just, you'd have to add many zeros to the 15 million. It's not a viable option. The nickname Forever Chemicals means that they're going to stay in the water table for a very long time. The alternative is probably to get water from a well that's very far away and not contaminated and have a water pipeline, to bring it to La Baie. So if I rely on what you're saying, we have to find another source of water. The long-lasting solution would be to find another source of water for La Baie's population. Well, that's the least expensive solution. It's possible to treat the water, and they're doing it now. They could set up a permanent plant, not a temporary one, to treat the water. But the costs are high. And, if you go back to my fruit salad, the PFAS profile in La Baie is more difficult to remove. So unfortunately, they've got a PFAS profile that's more difficult to treat and remove, which may explain that the $15.5 million was supposed to help the city of Saguenay meet the population's need until 2028, but they have already gone through that. They will have gone through that in July, because you have to change the filters 6 times more frequently, or much more frequently than what was estimated, so that the city of Saguenay has a liability of $7 million a year. I would like to hear what you have to say about this. Could there be another source of contamination other than the Bagotville base? Well, of the 400 sites we sampled in Quebec, 5 or 6 were contaminated to such an extent that intervention was probably required, and they're often dumping sites or near airports with the firefighting foam, or there's a military base. Is there a dump site close by? It's clear that there could be some sites. Maybe such a site contributes to contamination, but these sites also include old PFAS. And these are not what we're seeing in the profile. In the La Baie profile, we're seeing the firefighting foam profile.
Thank you to the chair. Thank you to all the witnesses for appearing. So what we've heard in the past in testimony is that for each contaminated site, the manager of that, the steward of that, has full control over the site. So for the case of D&D, they are responsible for whatever happens on that site, for testing, for communications, and all of that. Now, I mean, your experts in your field. In your determination, we have base commanders, but we have environmental officers who are making these decisions for the health and safety of their people. What kind of qualifications are truly needed to be able to do that work, to determine that a site like a Bagotville or what have you is actually safe? And I don't know if you know, but do those environmental officers, are they trained to have that level of expertise?
All right. Well, the easy way to do this is when we have legacy contaminants for which we have clear guidelines. Then it's easy. We measure how much is in the drinking water and are we above or below the guideline, then it's clear. In the case of something that's not regulated, it's a lot more complex and difficult. But once you have a recommendation from Health Canada that has all the required experts that looked at the issue, then you can just compare your data to what is recommended by Health Canada. If you're just looking at drinking water, of course, if you want to transfer drinking water to, is it safe to have a garden and to grow your own vegetables, and if you've been using that water, then it's a lot more complicated question. But if you're comparing drinking water to something where some official body has made that level, then it's relatively straightforward.
Okay. Oftentimes that amount of information, right? Like it seems to be going one way in terms of the communications are one way in terms of auditing and oversight. The issue with a lot of D&D sites is because of ideas of national security and what have you, there isn't a greater oversight from that larger community of experts like you. Have you run into that issue? Do you believe that we need to have better oversights built into the federal contaminated sites plan?
Well, I don't know all the details of those oversight, but I mean, the best example I see, if I could have access to all of the firefighting chemicals that have been used at the site, it'd be a lot easier to answer the earlier question of whether or not it's definitely traced back to the base. That information is not available, and I don't think that access to information with the military is working. So I mean, and it's probably not a tactical. There's nothing strategic or tactical about the type of firefighting foams that have been used. It's mostly a protection of liability. It's not so much a tactical question.
Like to add to that, I think, as I mentioned, that this country, we do have a lot of expertise, and from academia, from a consulting industry, from the government, right? You have ECCC, you have Health Canada. So definitely a lot of, when we talk about PFAS or legacy contaminants, and we have a lot of expertise, it's more about how do we get that expertise involved. And again, oversight with D&D sites is understandable, but if there's a way that could build into some kind of a mechanism, I think that will help a long way.
There's a lot of conversations about PFAS, for obvious reasons. But can you talk about as well, I think, Professor Wang, you talked about mercury, microplastics, the oil spills. We've heard about TCE, hydrocarbons. Can you talk about how we are determining in terms of those longer-term impacts as we see them, especially as we talk about the legacy, but also maybe the non-regulated, those longer-term health impacts? How are we measuring that? How are we looking at that? Do we have enough resources looking at that?
Yes. Yeah, mercury is a contaminant I study the most, so I think I can use that example, right? I'm not pointing fingers saying that the D&D is responsible for mercury contamination in the country. It's only a small player in the big kind of a complicated picture. Mm-hmm. But we do have long-term monitoring, both from the environment, from water, air, but also from fish. But actually, when it comes to mercury, we actually have long time monitoring for people for human health, for example, blood, right? Especially in women of childbearing ages across the country, especially in the north. So those data are available. That could serve to some extent example for other contaminants, right? When we're doing this kind of a human health study, it would make sense to start to monitor other contaminants. In terms of emerging contaminants, the microplastics, those oil spill, especially in the Arctic, oil spill is per se is not necessarily an emerging contaminant, but in the north, we start to see shipping, say, throughout the high Arctic, Hudson Bay. So those oil spills, whether it's from the ships or when they were refilling communities, or you have a military base operation in the north. So those things do happen, and so that's a lot of this is still in the early stage, as Dr. Sauvé mentioned, that we don't really have very good idea of what's going on. So that's kind of something we can build on based on lessons we learned from Mercury and others.
Ms. Gallant, 5 minutes.
What are the health risks for contaminants like benzene, toluene, or ethylbenzene if an individual were to be exposed to them via groundwater?
I can address a little bit, but maybe Dr. Sauvé could add to that. Yes, so that's what we call BTEX, right? So it's we're talking about the relatively small organic hydrocarbons, and so those often are associated with, let's say, petroleum oil and as well as other sources. And those are not necessarily long-lasting, so they are, if there's any good thing, those typically do not last in the environment for very long, but when you have them in groundwater, it could still persist for a relatively long time. So, but yeah, those are relatively easy to be monitored and often relatively easy to identify their sources.
Okay, so is groundwater contaminated with PFAS safe to drink?
PFAS, I will defer to my colleague here.
It depends how much, because I mean, contaminated means there's more than the background. So I think it's a question of how much, and the answer varies. So between the countries you are and what the experts have evaluated. So there's a bit of a gray zone, but.
All right. So what are the health risks for individuals exposed to polycyclic aromatic hydrocarbons if they seeped into the groundwater?
So that's, we call PAHs, and those, again, and they are known or probable human carcinogens. So again, bottom line is it's always about the concentrations, right? As an environmental chemist, I can tell you if I have the good enough detection limits, chances I could detect just about everything in any media. Just because something is showing up in your water, in the air, it's not necessarily kind of a huge concern. It's all about the dose, the concentrations. Okay. So we need long-term monitoring data to see the concentrations, to see how long a specific human population or ecosystem is exposed to.
Okay, so we know that during the 50s, 60s, that Winnipeg and Suffield, the populations in those areas were sprayed with a cadmium gas. Is there, when you go sampling public water places, are there any traces of cadmium still lingering in the water in Winnipeg, for example?
Yeah, I heard anecdotal kind of a story, and I don't really have the primary literature to back me up, but I think what you mentioned is probably related to Churchill. I heard the story that could be related to, as I mentioned, in Churchill, you had quite extensive military operation from the U.S. during the rocket launching kind of era. But I'm actually not aware of such things happening in Winnipeg.
Okay, so in your testing, is there any evidence in these public water samplings that any populations in Canada, no matter how concentrated or maybe remote and dispersed, is being tested upon other than perhaps the usual agricultural chemicals that are sprayed on farms?
I think there are a lot of ongoing monitoring programs that will include, say, cadmium, as you mentioned, right? It's drinking water, and those are commonly tested, and they are, for those contaminants, they're very well established, the drinking water guidelines. So I would assume that the health authorities or whoever is monitoring with the long-term program, they should have access to that data. One thing, of course, often we hear in the news is about lead in this country, and that's not necessarily due to military operations, but that just gives you idea that those monitorings are ongoing.
If any peculiar substances have you found that were rather inexplicably assigned, is there any evidence that any low-flying balloons, for example, any type of dispersal that is non-agriculture is still occurring anywhere?
There's some pesticides used within forests or for non-agricultural application. They would still be pesticides, but it would be non-agricultural. Pesticides contain PFAS.
Is there any evidence or background in what you have done to suggest that there had been previous military spraying or use of chemicals in Attawapiskat? There's quite a bit of groundwater, non-natural substances there, the tables show us. So I just wondered if that was related to any military activities at some point in time.
I don't know about that.
Yeah, I have no
Very
idea.
good.
Okay,
Yeah.
thank you, Ms. Gallant. Madame Nambropoulos, 5 minutes, please.
Thank you, Chair, and thank you to our witnesses for being here with us to answer some of our questions. Monsieur Sauvé, mes questions sont pour vous.
My questions will be addressed to you. First of all, you mentioned that you had met with Health Canada. I would like to know what your experience with Health Canada was like. Were they receptive to what you were telling them? I would say that Health Canada was very pleased to be contacted by me. They were very happy that I shared the information with them. I imagine that not every professor shares their information. This was something that was yet unpublished. I asked them to not publish it outside, but they could use the information because there were issues to discuss. So when there's a public health issue, I tend to be quite generous. Now, Health Canada and Environment Quebec or whoever else, I share the information because there's a public health issue. But they're not going to tell me about their new data. You know, it goes only one way. Did you find that? Did they react? Did they take any steps to improve the situation? I am convinced that the data, which represented nearly 500 samples in Quebec, this was probably the largest PFAS drinking water sample in Canada. So the information was very valuable for them to make recommendations because the PFAS recommendations have to integrate impacts on health, but also you have to come up with something that's reasonable to manage. There's a management element as well. You can't say that all of Canadians' drinking water is bad and you have to treat all the water. So you have to assess what it will cost and whether it's reasonable. The data show that with what was being proposed, less than 5% of the network's needed treatment. It was complicated for people in La Baie, but they were talking about very specific cases. So these cases can be managed if you know where they are. Thank you. You also talked about U.S. guidelines and directives, and in Europe, you said they're stricter than what we have here in Canada. I'd like to know whether you have any limits that you'd like to recommend for us to have here in Canada. The U.S. are stricter, but for 5 or 6 PFAS that are specific. For the other PFAS, they assume, and this is a question of how you apply the precautionary principle. With similar, there are other PFAS with similar chemical structures, but we don't have the necessary science in terms of toxicology. So if you have a PFAS molecule that is similar to something toxic, but we don't have proof that it's toxic, do you presume that it's not toxic and you don't regulate it? Or you say that because it's similar, you should regulate it similarly until you have other information? That's a big difference between the U.S., where they regulate 4, and Canada, which includes 25 lumped together. That's a big difference between the two. I think that the Health Canada approach is the right approach, because there's all kinds of toxicology information coming out every single day. So things will become clearer, but while we wait, let's be cautious. Thank you very much for your answers. You did ask a question at the end of your intervention. You said, why is it an independent researcher is the one who found this problem? I'd like to ask you a question about that. What do you think the Canadian government can do to take preventive steps or to carry out the testing themselves? Do you think that there are indications that a particular site could have more? Should we be doing more testing? What are your recommendations? A private lab PFAS test costs $350 to $500. So there's a budget component. You have to have the money to carry out the analysis. You also have to have labs that have the capacity and the detection thresholds and the standards which increase the detection limits to be able to have labs. Now, in terms of the Bagotville site, if you use this as an example, members of the military and the Health Canada were not so surprised that there was an issue. They were perhaps surprised at the extent of the data, but they weren't so surprised because they were thinking that there was a potential for risk. They had an idea that there was. So there's the environmental follow-up, and there's also forced transparency mechanisms so that the results should be made available publicly. So, yes, you can access the data, but it's kind of discreet.
Yeah, we've gone around a round of 1.5 rounds, and Dr. Ferguson has been either unable to interject, use the raise hand function, or signal by some means if you have something to contribute. But
Will do. I appreciate it. Thank you.
Okay, it's disadvantageous to come in virtually as opposed to being present. Monsieur Simard, 2.5 minutes, s'il vous plaît.
Merci.
You have 2.5 minutes, Mr. Simard. Thank you. You concluded saying that people at the Bagotville base didn't seem to be surprised with what you were telling them. So I understand then that in science you don't approximate, but earlier you explained that there's you can see PFAS a little bit like a fruit salad. And I imagine that one of those fruit is in the Labé contaminated water that is very similar to the fruit that we could find in the firefighting foam. Am I mistaken? No, that's exactly it. So you talked about landfills or dumps that have PFAS. And so we would be able to say that water is likely contaminated by a PFAS source coming out of the firefighting foam used at the Bagotville base. The profile of PFAS in the bay is compatible with contamination by firefighting foam. It is not compatible with a landfill site because the bouquet would be more complex with PFAS. In other words, does the firefighting foam come from Bagotville or somewhere else? I can't say, but it's compatible with the profile of firefighting foam. I can certify that not a lot of farmers are around Bagotville base using firefighting foam to put out their fires. Well, maybe there could be firefighting training or a fire hall. Well, let's just say that statistics can answer that issue, but I don't want to put any words in your mouth. This being said, earlier I was referring to the issue with what we're seeing in the Saguenay, where they had to change the filters much more frequently than what they had expected. Is this because of a particular kind of PFAS? The type of PFAS associated with certain recent firefighting foams, which are smaller and harder to remove. Well, if there's a budgetary shortfall, it could be also related to how they planned the contract. Maybe it was a turnkey contract where they said, we'll give you this much to treat it for 5 years, and clearly that wasn't what was agreed. Maybe perhaps there was some vigilance in the writing of the contract.
Madame Masson, 2.5 minutes.
You were, Professor Wang, you were talking specifically about, again, back to mercury, and it may not be as related to on-base contaminations. However, there are instances where, in Goose Bay, for example, there was buildings shut down because of it being used in dental work, for example. Do you see a lot of that in any of your research, or?
Yes, yeah, definitely mercury is still, even though we call it a legacy, but still ongoing, that the major sources have been placed under control. But yes, mercury continues to be used in certain applications. But with the new international treaty called the Minamata Convention on Mercury, which Canada signed on, and there is a plan, there is limitations on how those practice can continue. So I would say that with time, as the convention starts to be more enforced, then the application of mercury in dental practice, in thermostats, and so on should be used less and less. But the challenge with mercury is even though it may be a very small amount of mercury used in dental practice, it doesn't take much for mercury to actually have a major impact. This comes to some extent very similar to what we talked about the PFAS earlier, talk about the number, right? Which number is safe? Contaminants like mercury is very difficult to prescribe a number, what's the guideline in water, because this contaminant biomagnifies. So even though the concentration in water could be extremely low, by the time it gets accumulated in fish and in human, the concentration could be high enough. So.
You also talked about, and quickly, we did an Arctic study. It was talking about the opening up, of course, of our Arctic, and the increased transit through these areas. The fragility, I guess, of the land in that regard. I'm interested to know, in terms of what studies are being done, impacts on Indigenous people in those areas, even in terms of the land, the food that they live off of, the traditional foods, that sort of thing. What kind of research is being done?
That's actually a lot of extensive studies going on in this country as part of a research network called Arctic Net, and we've been monitoring contaminants as well as part of a Northern Contaminants program within this country. So in many cases, there have been decades of data, both from ecosystem, from food items, all the way to human health. But in the meantime, with the
unfortunately, Ms. Matz has left you no time to answer the question. Mr. Bazan, 5 minutes.
And want to thank our witnesses for joining us today. Professor Sauvé, in your testing with Labai near the Bagotville Air Base, how many tests have you done since your first report came out?
How many samples? I think originally we had, originally we just had 1 or 2, and then so we had to confirm that, and then we have about 10, which were doubled by what the ministry and the city measured. And I went back this summer to make another 15 samples to see what the situation, whether the treatment was working and whether the others were still. So I don't know, 25 more or less from around that.
And has the situation improved, or is it still the same problem?
Well, the treatment in place in the areas that were treated, for the most part, were below the threshold of 30 recommended by Health Canada, except one sample at the end of the network that seemed to be around 40. So one of them, probably because a bit further down the academic network, was above. And the few samples from wells that were not treated or not through the treatment that's been in place were still around 80 or something, so well above the 30 the threshold of 30.
And you have been able to rule out any other sources for the contamination other than CFB Bagotville?
Can't rule out any other source of firefighting foam. It's compatible with contamination from firefighting foam. The Bagotville base uses firefighting foam, so it seems, in all logic, the most plausible explanation.
And the municipality would not be using the same type of foam in their operations and in practice?
Well, I mean, firefighters would use this on a chemical fire. So if you have a big industry, some industry using chemicals or with hydrocarbons, if you have an oil spill, then you would use those. But if a house is burning, you just use water. You don't use that. It's really just for chemical fire or hydrocarbon.
And in the subsequent tests that you've done, you still haven't had much of a conversation between Canadian Armed Forces and National Defence to go over your findings?
I haven't pursued the conversation, and I must say that the way the situation in L'Abbé was presented to the media, I didn't get a good communication link with either the city of L'Abbé, the local public health, and the initial nice conversation with the defense I sort of shut down. So everybody sort of didn't like that I presented the data out.
Okay, well, I think one of the recommendations we'll want to make is to ensure that those conversations take place going forward. Professor Wang and Professor Ferguson, we've had conversations in the past, and I want to talk about mitigation, and especially with the experience that you guys have up at Churchill at the rocket facility and the old base up there. What can we be doing to ensure that these legacy contaminated sites are properly mitigated to protect local populations and the environment?
Yeah, I can jump in on that. Thanks very much. I think the biggest thing that we can do is collect data. Data is what will inform these decisions. As you've heard from my colleagues, there is so much that can be done to do different sampling across different areas. I want to echo what my colleagues have also said about artificial intelligence. It can be used, if used appropriately, to collect data and look for patterns in that data. But we need to collect that data. We need to transmit that data to people that know how to handle it and can actually crunch that data in a way that will tell us those answers. But it's all about data. It's about collecting that information and looking at it.
Have that data line, but then how do we fix it? So where's the mitigation? Like, how do we contain it and ensure that it's removed from the site?
Yeah, well, first of all, I have to say that at this time we don't really know too much about what's kind of left there I'm using Churchill only as an example, right? That's the site that I know the most, but still we don't have much information. A lot of these things were poorly documented and even poorly studied. So the first thing is we need to identify which kind of contaminants are there. Is it qualified as a contaminated site, for example? And then we start to look into how to mitigate. And one best source that we could get is actually, in addition to scientific testing, is actually get the information from the community. Many folks are still there, and they know the operation. The other part of mitigation is to make sure that the new operations, any new development, will follow a very different model, right? You mentioned the Churchill Marine Observatory that I'm leading, and those kind of research we're doing, we want to make sure we learn the lesson from the past, we engage community folks from the very beginning, so it's been transparent, and so they are fully engaged in this process. And we hope as our operation, our study in Churchill getting ongoing, and that kind of
unfortunately, we have to leave it there. I apologize for cutting people off, but it is what it is. Mr. Collins, don't let me cut you off. 5 minutes.
Thank you, Mr. Chairman, and good morning to our witnesses. Dr. Sauvé, coming from the municipal sector and coming from the city of Hamilton, where we have a lot of industry and a lot of contaminated properties over the period of a century and a half, I found that when dealing with contamination and public health related matters in the community, that the community wants to know as much information as possible, as soon as possible, to ensure that they can protect or take measures within their home or around their home to protect their health and the health of their family. You described a situation very similar to a couple of situations that I've dealt with in Hamilton, and I had the opportunity at our last meeting to ask government officials about transparency and what policies the government has around transparency. They noted that in 2019 they improved the policies around transparency and gave some examples in terms of how they're trying to make those policies better. You've described a situation where it looks like there's some room for improvement, and this committee is undertaking this study to look for recommendations to improve policies. Can you provide specific recommendations in terms of, and I know you dealt with probably 3 levels of government, dealing with the La Bay situation, but can you provide recommendations that the federal government can take into consideration for the purposes of improving the transparency measures that we have in place today?
Again, it's a tricky question. It's not an easy, there's no easy solution.
Understood.
I think that the data, and it's been mentioned by my colleagues, I think getting as much data easily, that can be found easily, because it's not just acquiring the data, it's getting access to it so that people can understand and get access to the data. I think that would help quite a bit. But
Check just quickly. I think if government officials were here, they'd probably point to the government website to say, we list all of our contaminated properties that we have here, and that information is there for the public to review. And I don't think, based on your comments, that's good enough.
oh, have you tried to find that data on your website that has all of it? It's very difficult to find. Even when sometimes I work with someone from some ministries, hey, it's all on the website. Can you send me the exact link? Because I will not be able to find it. So in terms of findability, it's important. So yes, sometimes the data is out there, but it's difficult to find.
Okay.
That
Fair enough.
one step.
Thank you for that. The other question I had was around compensation. There are instances where when the term we use is custodian, we're the custodian of these sites with legacy contaminants, and sometimes those contaminants find their way off a property. You've highlighted the impact that it had on a community, and I've dealt with that situation both with the federal and provincial governments, and it's not easy getting compensation for individual property owners and or the community at large. And it's almost like pulling teeth, and it can take many years just in order to get basic compensation. And it always seemed like, in my mind, we were never fully compensated for the issues that we were dealing with. You've described a situation where there's still an impact today. Do you have recommendations around compensation as it relates to when the government knows that it's their site that's caused this problem? What recourse should there be for individual residents or a whole community that's been impacted by those issues?
It's tricky. And it goes back to maybe your earlier question where there's liabilities and tools and means that are intermingled between what is federal, what is provincial, what is municipal. So maybe, and I'm not a constitutionalist expert, but maybe making the rules more clear or the processes through which we deal with these, because everybody's sort of touchy and nobody wants to put their toes in the water because they don't want to get the liability for the whole thing, and just recognizing that there's a problem then becomes a liability.
Watch your toe.
Left?
You have 31 seconds.
Okay. Mr. Wang, can I quickly ask you that same question in terms of compensation for communities? You're dealing with Churchill, and I'm sure there's impacts there.
Yeah, well, 30 seconds, there's no way I can say it. But one thing I do want to say is that you just need to avoid the lessons to be learned from something like a grassy narrow kind of a compensation. And that should be something the government that really seriously think that we should avoid any other cases like that. That's absolutely not the way to go when it comes to compensation.
Thank you.
Hope that's within 30 seconds.
Thank
First
you.
time I'm on time.
Yes, exactly. No, you've got 3 seconds left. On behalf of the committee, I wanted to yes?
So just because there were so many cutoffs and there's a lot of information, I'm just wondering if we could make sure that the witnesses knew that if they wanted to submit anything at the end, that
I
would
was
be...
just going to address that
Oh,
issue.
great.
Yes,
See?
yes, yes.
Great minds.
Yes.
That's the nicest thing.
We won't go the great minds route. I want to, before I was interrupted, I wanted to thank you. And now that I've been interrupted, I still want to thank you for your contribution to the study. And just along the lines Ms. Masson has alluded to, Canada's under enormous pressure from our allies, but also our adversaries, to make minerals in particular available. The Chinese have just cut off certain critical minerals to the creation of chips. We will be putting F-35s in Bagotville. So none of these problems are going to go away, The real question is how to deal with them better. And you folks have, for better or for worse, have been dabbling on the edges, for want of a better term. I think the committee would benefit greatly from your thoughts as to how Canada, DND, CAF would deal better with our defense security pressures going forward. That if we don't learn from the past, we're kind of hopeless. So that would be a real contribution. So in the event that you just happen to be thinking about things like that, we would appreciate it. So with that, we will suspend. Yeah.
They are now.
Yeah. Joining us in the second hour is Dave Hovington, Chief Fire Inspector, Shauna Plourde, Health Services Clerk, and personally appearing here is Aaron Zimmerman. I'll ask each of you for your opening 5-minute statements, and I point out, colleagues, we're almost 15 minutes behind the clock, and we do have to yield the room to another committee. So I may have to run the second hour a little bit tight, or second round of questions a bit tight. So with that, I'll call upon Mr. Hovington for his opening 5 minutes, please.
Thank you, sir, and the Honorable Committee. I joined the forces in 1985 and dedicated my career to protecting lives and training others as a firefighter. After completing my basic firefighter training at Borden in 1986, I served in Moose Jaw, Borden, and West Coast, responding to emergencies and training on countless fires. Back then, we used what was available, thousands of gallons of flammable liquids and thick layers of foam to simulate real-life scenarios. Safety and readiness were our focus, but we never imagined the long-term health risks these materials posed. Decades later, and often the personal cost of those practices. In the fall of 2022, I was diagnosed with multiple myeloma and cardiac amyloidosis. These illnesses have drastically affected my strength and vitality, reducing me from someone who once ran daily and lifted weights to someone who struggles to walk 100 meters. The toll has been immense, not just physically, but emotionally. I'm grateful for the support I've received from Saskatchewan Workers' Compensation from my present public service role, but have yet to hear anything about my VAC compensation for military services. My story raises serious questions. Why weren't the risks we face as firefighters and military personnel more fully recognized? Why weren't steps taken to protect us even as we put ourselves on the line to protect others? This isn't about my personal journey, but it's about a broader issue of accountability and transparency, especially regarding environmental safety. Just a month and a half ago, an incident occurred that highlights these concerns during a hydrant repair near Hangar 6. Workers unearthed soil with an extremely strong smell of fuel. The odor was so potent it could be detected 20 meters away. Samples of water and soil were collected, but no one seems to know where these samples went and what the results were. Who is ensuring accountability for these testing processes? This is not an isolated case. At Hangar 7, we had a pile of contaminated dirt that initially failed environmental tests. It was covered with plastic and tires to seal it, but this covering deteriorated, leaving the pile exposed to the elements for nearly a year. Workers expressed their concerns about their health, and the pile was eventually moved behind the mess hall out of sight. Following the relocation, a new test was conducted, and suddenly the contamination passed. This raises troubled questions. How are these tests being conducted? Are the criteria being adjusted to meet convenience rather than fact? We also notice a pattern. Contaminated sites sometimes disappear from records after buildings are demolished or houses are moved to less visible locations. Are these sites cleaned up properly, or are they simply being hidden from view? These are legitimate concerns that deserve clear and honest answers. I have served this country proudly for decades, trusting that our institutions would protect not only us, but also our families living on bases. Canada is a democracy built on fairness, accountability, and human rights. Yet, the lack of transparency in occupational health and safety meetings undermines these principles. How can we protect ourselves when we aren't even informed about the risk? How can we have meaningful safety discussions when critical environment assessments are withheld? Our health, our trust, and our well-beings are at stake. I ask all of you today to help ensure that these issues are investigated truly and transparently. Let us demand a system where contaminated sites are properly addressed, not just relocated. Let us push for environmental testing that is consistent, credible, and reliable. Most importantly, let us make sure that no one else has to face these challenges that so many of us already or whether from health and effects or past practices or from living and working in unsafe conditions today. I've given my life to serve in Canada all, and I ask in return is that we honor commitment to protect those who serve and their families. It's not just about accountability, it's about trust, safety, and doing the right for us and the future generations. Thank you.
Ms. Plourde, 5 minutes, please. Plourde, you're on mute.
Thank you to the chair and honorable members of the committee for granting me the opportunity to speak to you today and for your time and dedication to addressing this critical issue. 31 years ago, I was a young married woman full of excitement and hope for my future. My husband, an aircraft engine technician for National Defense, and I were expecting our first child. We had just moved into private married quarters on the base, and I had begun working as a clerk at the base convenience store, Mechanics. I felt incredibly proud of the life we were building, a life centered on service, community, and the Canadian dream. I never imagined that this dream would turn into a nightmare, one from which I cannot wake. 9 months ago, a simple yet alarming question started being discussed in the building I work in. Do you think our building is safe? This question and the discussions that followed opened a door to truths that have been devastating to learn. I am proud to have served as a public service employee for over 3 decades, supporting members of the Department of National Defense. Yet over the years, I have lived and worked in buildings, sent my children to daycares and schools, and used facilities that I now know are directly on contamination sites and within the areas contamination sites exist. Despite this, we were never told. After moving onto the base in 1993, I began experiencing medical issues. At the time, I attributed them to the challenges of being a new mother and working hard. But by 2001, after 7 years on the base, I was diagnosed with a neurological disorder with significant neurobiological consequences that has progressively worsened, requiring increasing medication that now affects my memory. Over the years, other warning signs emerged. In 2017, I had an emergency hysterectomy, and since this time, 4 other women I work with have all had to have this procedure. Many of us have been employed in the same building, Building 143, for our employment. Around the same time, we noticed several colleagues, both military and civilian, were battling various cancers, autoimmune, thyroid, and neurological issues. This April, the pieces of the puzzle started coming together. After months of personal investigation, discussions, and interviews, we discovered devastating patterns. Over 50 deaths in a short time frame in 7 buildings, and approximately 200 illnesses among those connected to our base, 15-wing moose jaw. This includes cancers, thyroid disorders, neurological conditions, and other life-altering illnesses. These are not isolated cases. Our findings suggest a widespread issue of contamination affecting bases and military housing across Canada, impacting not only military members, but also civilian employees, their families, and even children. I count myself lucky. My condition, though challenging, is somewhat manageable with medication, but many others are not as fortunate. My friend and colleague, Erin Zimmerman, 46-year-old mother of 4, has been diagnosed with intracranial hypertension, causing a visual impairment and young onset Parkinson's disease, a rare condition for her age and linked to chemical exposure. Erin works now in Building 143 and was with the Snowbirds previously in Hangar 6. That is directly on top of an active contamination site on the federal sites inventory, where she spent one of her pregnancies. She was never informed of the risks. I think of my friend and colleague Dave Hovington, a fire inspector, a devoted colleague who continues to work tirelessly despite battling cancer. I think of my own family, My pregnancies were complicated, and my children were born with extremely low birth weights. My daughter now struggles with neurological and endocrine disorders, and my son faces chronic lung and gastrointestinal issues. I now wonder, were these the consequences of living and working in contaminated environments? We have discovered that contamination exists all over our small base, where we have hangars, flight lines, fire halls, a previous school, daycares, and homes. And yet we were never informed. No one told us about the risks we were exposed to daily. My husband, who has served for over 35 years, has witnessed unsafe practices such as chemicals being disposed of improperly without protective equipment. He now shows early signs of neurological disorder. His colleagues, many of whom have worked under similar conditions, have faced cancer, cardiac issues, and other severe health problems. Some have passed away. Through thousands of hours of research and data collection, we have uncovered a systematic failure to address these issues transparently and effectively. Those of us who have sought answers have faced skepticism, criticism, and now retribution. But we persist for those we have lost, for those who are suffering, and for those who may yet be affected. So I ask you, why were we not given the right to know? Why are our children allowed to attend daycares in contaminated environments? Why is it acceptable to put lives at risk, military, civilian, and our families? And most importantly, what is the cost of a human life? We must act, not just to address the tragedies of the past, but to ensure a safer, healthier future for all Canadians. Thank you.
Thank you. Ms. Zimmerman, 5 minutes, please.
Thank you to the Chair and honourable members of the committee for the opportunity to be here and dedicating your time to this discussion. While today's conversations centre around facts and policies, it is important to recognize that these are not just abstract issues. For many Canadians, these are personal. People across the country are watching, seeking answers and oversight of safety in their communities. This conversation demands urgency and compassion. It is crucial to find a path forward that prioritizes transparency, accountability, and the health and safety of all Canadians. Unfortunately, systematic issues have created a system made impossible for D&D to review through an internal process. I strongly encourage creating a dedicated budget line item in the next budget to fund an independent, comprehensive review of D&D contamination sites. This initiative should be directed before the President of the Treasury Board, Honourable Anita Anand, with oversight and involvement from Canadian Occupational Health and Safety and Health Canada to ensure impartiality and effectiveness moving forward. A question has come forward of how employees in surrounding communities were not advised about the federally managed contamination sites in the areas they work and live. Without disclosure, employees and members of the community were unable to ask questions and raise concerns regarding these properties. Lack of transparency and communication of these sites has left and will continue to leave irreversible impacts to these communities and within these areas. Canadian Council of Ministers of the Environment, CCME, saw a need for implementing the requirements of a program to provide guidelines identifying contaminated sites to ensure monitoring for safety of environment and human health. In 2005, the Federal Contamination Sites Action Plan, FCSAP, began in response to provide transparency to Canadians and federal departments by listing unprotected sites in the Federal Contamination Sites Inventory. Under the Treasury Board directive, management of real property, federal organizations are required to report, update, and certify sites data regularly. Under CCME guidelines, classified sites must be monitored for potential adverse health effects. We must ask ourselves, people on these sites were not informed or educated on the reporting process. How could they have known to report illnesses or deaths on or close to these properties, and where would they have reported? Given this gap, it is absolutely essential to determine how we can now align our actions with the program established guidelines to move forward at this time. Under CME guidelines, how are health assessments on D&D sites completed? D&D is using CAF Medical that has its own internal medical system. Within this system falls DFHP and PMed, which is preventative medicine. They operate under a strict mandate focused on focused on military members and operations only. This excludes civilian employees and surrounding communities, leaving significant gaps in medical oversight. CAF employees do not always fall under certain provisions of the Canadian Labour Code in certain instances. So how can CAF medical health assessments mandated to members only ensure that health evaluations are done for all individuals on those sites? The lack of disclosure of contaminated sites prevents individuals from applying for WCB and VAC compensation claims. Claimants must provide key documentation, including area worked, work time, a list of contaminants, and their supporting medical documentation for a subject matter expert to evaluate if their illness is considered occupational. Occupational illnesses are assessed by the recommendations made by the Canadian Occupational Health and Safety. These situations are to be looked at by Health Canada with occupational list that is created by the United Nations. It is called the ILO, the International Labour Organization. Looking through VAC public information and WCB policies, it shows WCB follows this recommendation. What standard is VAC following to assess occupational illnesses? If it is not using the recommendation, the question now is why? Based on CAF policy, members sometimes fall outside of the Canadian Labour Code standards while on domestic properties. These times occur during specialized operations and training only. This brings up an absolutely critical question. Should the ILO occupational illness list be applied when CAF members are exposed to contaminants in their homes, units as documented in federal inventory? This raises absolutely significant questions about a potential conflict of interest for D&D to evaluate the program and the management of these sites. And thank you very much for your time.
Thank you. Thank you, Ms. Zimmerman. Mr. Tolmie, 6 minutes, please.
Thank you, Chair, and thank you to our witnesses for joining us today, and for those that have served, do appreciate your service. Obviously, with the testimonies that have been shared today, we have to recognize that it's not just military personnel that operate on a base, but it is also civilian employees and civilian contractors that help keep bases and wings and naval stations open. And I begrudgingly say naval stations, being an ex-Air Force guy. I've got a brother, or close friend of mine, who's in the Navy, and he's pointed out that I've not said that numerous times, so I'm throwing it in there for his benefit. We heard a little bit of Mr. Hovington's service history, and I believe it was 1986 that he was joined, and Ms. Pleward, you mentioned that your husband served as an airframe technician. Could you give me the locations of where he has served?
He has only been at Moose Jaw.
Okay. And Ms. Zimmerman, just for the record here, in what capacity have you served? And what roles have you served?
I was an RMS clerk with the Snowbirds for 4 to 5 years, but then...
As in the military?
Yes, in the military. I am a veteran, but then I changed over to public service, so that means I can speak to you today.
Okay. And so I cut you off there. What roles were you in you said as a clerk?
As a clerk, I was the claims clerk and HR clerk, so RMS at that time for the Snowbird Squadron, which were very busy there. I changed over to a public service role, and I've worked in procurement, contracting, and finance.
Okay, and how long have you been doing that?
I have been on base now for 13 years.
Okay. Have you served on other bases?
No, I'm actually from Moose Jaw. It was my first place to be, and I met an amazing person, so I transferred to public service so I could stay. It's a great place.
I'm very proud to serve as their MP, yeah. We've been hearing testimonies from the Treasury Board, National Defense, Veterans Affairs, and we understand that they've got a list, and they've got an understanding of that there are contaminated sites, that they have to deal with contamination, and Department of Health. But you've mentioned about the labor code. I asked in one of the meetings that we had with Veterans Affairs if they looked after civilian employees. Would you be classified as a veteran, or would you be classified as a civilian to deal with the health issues that you're struggling with?
So after I've gone through all of the policy for VAC and the policies and management of how occupational illness is done and the policies for WCB, it's become very evident that it will be very difficult for me to, well, I know I probably will never receive VAC, to be honest, with the policies the way they are.
Why is that?
WCB, it is caused by the fact, if you recall in the ACFA committee, there was a recommendation 17, and that is exceptionally important. They have to use a calculation. None of us at this table, even though we're very educated people, are not educated in the proper way, like the scientists before. They need to be able to calculate. I cannot tell you my Parkinson's disease with my education is caused by the contamination site. I can tell you what my doctors have said. But to be able to prove it, I need to have a map, the list of contaminants, and how long I have been there. But you guys haven't even allowed people to apply for WCB because they can't even get that information.
What do you mean by why people can't apply to WCB? Are
Well,
we talking
number
about
one,
civilian employees?
So they don't know to apply, number one, because they don't know that their cancers could possibly be caused, because they would have to know what the ILO is. When you look at the ILO, the United Nations has done it very well, and it was updated in 2010. So you can go and take a look and see if the contaminants you were on to the diseases that it matches within science that's always changing, which we know. So we know we need scientists from the United Nations to do this. VAC and CAF, from my understanding, is using something called an index. So I've done multiple interviews with people that are service managers, people doing back claims on the side, old retired medical staff, and old retired admin staff. What is happening is we are probably using something called the guideline or the index. So we are actually deciding what occupational illnesses that we will let through the gate. We have Girls from Women's Health Initiative. They can't get compensation due to the fact they can't get the calculation, but they wouldn't even get a chance to get to the calculation in a VRAB appeal, because the VRAB appeal needs them to pass the first gate. Apologies.
Okay. I have.
Yeah.
Okay, I've got a lot more questions.
Yeah, don't we all? Don't we all? Ms. Lapointe, strangely, a happy birthday, but this is a strange time to wish you a happy birthday. Anyways, go ahead.
Thank you, Chair. So I just want to extend, on behalf of everyone here on the committee, to tell you that we are very appreciative and grateful that you're here today. We're hearing about your experiences is very difficult, and I can assure you that there is no one in this room that will forget your testimony here today. Mr. Hovington, I believe that you were a recipient of the Governor General's Award of Excellence in Emergency Services, so I do want to acknowledge your service, and I would like to ask you, what support or assistance did you receive from the department following the exposure, and what support or assistance do you believe would have been helpful that you weren't able to access?
I was guided by the Wing General Safety Officer to apply to workers' comp in Saskatchewan, which worked very well for me because within 2 weeks they started to pay for all my medications and all the time off I had to use to go to Regina for treatments and see the oncologist and whatnot. And she also advised to go to VAC, which I did, which I've yet to get any reply from them. And I think that the provincial, as soon as they saw Saskatchewan works comp, as soon as they saw the firefighter and multiple myeloma was automatic. I'm thinking that something similar should be happening with VAC. It should be reflecting that, so that would help a lot. Other than that, if it wasn't for Erin Zimmerman, man, would be in the dark out there. She's done a lot of research and guided us through everything, which we, all of us public service employees, really appreciate.
Okay, thank you. To all of the witnesses here today, I do want to tell you that I want to provide you with a form to further inform us about your experience and your family's experience. And so please feel free to share and continue to provide your experiences that you have. And if you would like to tell us, what changes would you like to see implemented within the department to ensure that the well-being and safety of employees working in potentially hazardous environments are taken at the utmost importance? And this is for any witness that feels comfortable in speaking.
I believe that first of all, we need to talk about transparency and what transparency means, because I'm going to tell you, not just because we've served your country, why this is so important to Canadian citizens. Other people have mentioned we have communities that surround these bases. If we are not coming up with the proper data because we are, what do they call it, interpreting it and giving you D&D's interpretation, that means that we are in a dangerous place for public safety. I am concerned for my family, but why are we all here? These people on the screen are incredibly brave. You have no idea, living day in and day out, what we have gone through for the last 12 months. But why are we here? We're here because we're the older generation. I always call myself the mom of the base. The kids come in, 20 years old, learning to be pilots. And guess what? They are incredible. They are smart. They send us the best. But the problem is they're alone. So they need somebody older that's got 4 kids like me that can listen to life. So why haven't I left with Parkinson's disease? I possibly could at least get disability. I don't know if I can. I'm very scared to leave because I have 4 children that are going through their educations and a family. I am doing it for the next generation. If you tell me I don't get a dime of compensation, if I know for a fact a mother does not have to have a discussion with her son about disability after 10 years of medication wearing off and how Parkinson's will become a big part of our lives, I want to know that there's a woman out there that raises her child and never knows I exist. And the people here as well. We do this for the next generation. We do this for the Canadian public. We do this for the kids in the daycare centers and for every community. We fight for you. That's why we're here.
Thank you, Ms. Zimmerman. Yeah. Are there others who want to share what changes they would like to see implemented?
I think Shauna definitely they both have a lot to say, but Shauna's very vocal about this. You go.
I think the biggest thing to me is transparency. They're talking about doing these testings and that kind of thing, but I don't believe that we're getting the real results. It's getting hidden. It's getting softened, if you you want to say when we get the test results? How, for instance, in Building 143, they brought somebody in to do some air quality testing. That was done for 2 months. We got the report back, and apparently the building is just fine. There's nothing wrong with the air quality. Then explain to me why we have had 3 people that I know of personally, and Aaron as well, that have passed away from breast cancer that were in that building. There's other people that have passed away and are sick in that building. We have taken a monitor and gone down. Poor Dave with blood cancer went down in a crawl space with the monitor, and the monitor was going crazy. But everything's fine in that building. So there is an absolute disconnect here. There's absolutely, to me, things are being hidden. Things are being shoveled under the rug so that nobody knows. It's all kept hidden. My 30-year-old daughter came in to me yesterday after having tests done at the doctor's office. She most likely will never be able to have children. 30 years old. And it has been attributed to living in private married quarters on the base. The private married quarters that we lived in have now been dismantled. They're torn down. Why? They were supposed to be so safe. To me, D&D is supposed to be there to care for and protect Canadians. They are our safety. So I'm a Canadian, just like you, just like everybody else. Why have I not been safe? Why have the other people on that base, both military, civilian, contractors, why have they not been told? Why have they not been kept safe? Because we've all given our lives to Canadians, to protect Canadians, but we're Canadians too. And we have.
Yeah, thank you very much for that. Mr. Sauvé is next, but he will be speaking en français. So for those of you who are not bilingual, you could switch. We hope that you're on.
Je ne sais pas si Monsieur Sauvé va parler, mais
I don't know whether Mr. Sauvé is going to speak, but Mr. Simard is going to speak.
je trouve.
No problem. I think what the witnesses are saying is so important and so touching. I'd like to spend 30 seconds tabling a motion on behalf of Madame Normandin, and then I'll quickly come back to the witnesses. So here is the motion. Given that the Bagotville military base is responsible for the PFAS contamination of the drinking water sources of nearly 8,000 residents of the L'Abbé area, and that the $15.5 million granted to the city of Saguenay by the government to ensure the treatment of these waters will be completely exhausted in July 2025, with the treatment of the waters requiring 6 times as many filters as planned, the committee believes that the Minister of National Defence should enter into a formal agreement with the city of Saguenay to ensure that all costs associated with the temporary treatment of PFAS-contaminated water and the establishment of a permanent treatment plant at L'Abbé are covered by the federal government, failing which the citizens of Saguenay will have to assume these increased costs through an increase in their municipal taxes of more than $7 million annually, and ask the chair to report back to the House as soon as possible. So we'll debate the motion later. I'd like to return to our witnesses, and I'm sorry, I didn't want to be cavalier. I just had to table this motion, put the notice of motion in. In your testimony, what I've understood clearly is the absence of transparency and the difficulty in having your occupational diseases recognized for members of the military who are on base and who are exposed to contaminants and toxic chemicals. I'd like to know, I mean, there are mechanisms when you're a civil employee, there are mechanisms to have occupational diseases recognized. In Quebec, we have the CNESST recognizing those diseases. We have Health Canada as well that can determine what kind of chemicals have impacts on health. And clearly, on base or in various bases, there should be some sort of medical department or service. So how are the three types of service coordinated? Is there sufficient coordination so as to make it possible for you to see the recognition of your occupational diseases?
So you're not being cavalier. You are being somebody that is asking such an important question, because your question is actually connected to ours. So I'm going to base everything I tell you on fact or something odd I have noticed, because that is how I've been running for the last 12 months. Right now, fact is PFOS is being cleaned up in North Bay for $20 million. PFOS is being cleaned up with you guys. We've had TCE cleaned up from Shannon. Why is that? And why? And that brings Engagetown, but we'll discuss that at another time today. So why is this issue important? TCE and PFOS are what Health Canada is allowed to see. That is why you guys are being classified differently, because Health Canada is seeing it when it enters the communities, because then the province and the federal government can get Health Canada involved. Health Canada is a department. Let's look at it as the pyramid it is. The only person that can come onto a D&D base is not Health Canada. They're a department. They can't tell on each other publicly. This is a problem. They can't. Neither can an Environment Commission. The only people that can come in is the Labor Board. So what does the Labor Board have to say? After lots and lots of emailing with them, I've realized the problem is if D&D can show that they are bringing in privatized firms to do the testing, like on 143, which they've also done, the list of contaminants, they will not come in because they don't have enough to issue a complaint. They don't have enough because there's enough money being spread out that they should know. Well, I'm going to tell you what's happening with 143, and I might not have a job when I go back. 143 has an issue. First, I found out, do you know a clerk, a CR4 procurement finance clerk, had to run around in the middle of the night and look at every single environmental assessment she can pull from the United States to be able to slip it to everybody that is D&D to put it on. Do you know they took all those chemicals off? If you do not test for it, it is not there. Is that how we're closing our sites? When we know that D&D, based on ADMIE's testimony, and the fact that Environment here was sitting on the TCE board as, what is it, an assistant deputy minister, told you, TCE, they've told you what Health Canada knows. They have not told you what is on those bases. That is the problem. Health Canada cannot come in. Environmental Board will not come in because D&D is showing, based on paper and statistics, that they are looking into it. That is a problem. We don't split contracts. That is an ill intent. We need to decide what is our intent behind our actions. Now we have criteria issues. How does a pile sitting right by the daycare center, blowing where my son went for a year, not pass when it is got contaminants that last for over 1,000 years in our soil, like you are dealing with, like so many of us are dealing with? The only thing I can come up with, based on talking to retired members, is criteria. How are we classifying the sites? Are we looking at it as far away behind the mess? Because guess what? If that is, it's different criteria because it's not by a person. Why are some of our sites closing immediately after being knocked down, but the land isn't? Because based on CCME documentation and policy and guidelines during, oh, sorry, sir. I was just sorry.
I appreciate I have been running a very slack clock, shall we say, but
Je voudrais simplement souligner, Monsieur le Président.
Chair, I would esteem that nobody should be fearful of testifying before a committee, and I hope that Ms. Zimmerman will not follow any kind of pressure after her testimony. And if such is the case, I would invite her to recontact the members of this committee.
I'll see it the same way, Mr. Savard. Madame Masson, 6 minutes, please.
I too want to thank everybody for sharing their stories today. This is extremely important that we get to make some changes that are very clearly needed, and as many of you said, for not only yourselves but the next generation. I did want to ask, it seems to me that in many of the studies that I've been a part of and conversations around D&D, that especially when it comes to sexual misconduct within the military, it was made very, very clear that there had to be an external review, right? There had to be, and even now, and rightfully so, the government is trying to ensure that cases are not internally investigated. This seems to me very much a parallel, that there's an internal investigation, things aren't being brought into the public. There's this idea that it has to happen under a guise of, or a cloud of national security. We all know that you know, we've heard many times D&D is risk averse. Does this fall into all of that? Is that your opinion?
Yes. And I'm not saying that based to be awful to D&D. I love D&D. It's my life. The people are my family, but what I am telling you, that D&D to me is the human beings that work there and what we do. But a system is built. It's built on budget cuts, lack of positions. So we keep the same amount and we do less, we do more and more and more, and we transition people and they lose things. We've created a system, but the problem is we have people in high positions that are educated and should be there. But the problems is there's a lot to lose. I've realized personally what it's going to be like if I'm unemployed, with Parkinson's, with a visual impairment. I'm great at my job. I'm good at policy. But I'm going to tell you something. Who wants to hire a visually impaired person with Parkinson's disease? That is my reality, and my brain doesn't stop. I want this to be fixed. Yes, it has to be out of D&D's hands, not because it's not amazing people. It's because we systematically have created a system that we can't tell the truth. Because if we tell the truth, we get demoted. We lose our jobs. We lose our income. We hurt our families. And we leave in disgrace. That's not what we need to do here. We need to rally together and be stronger and better. My dad was RCMP for 35 years. My grandparents served, my sister serves, my brother-in-law serves, and my niece grows up in the queues. We are an amazing group of human beings, and I am not disloyal. I'm disloyal to the system that was built that cannot look at this.
In that, taking it out of, and you've started to cover this in terms of what needs to happen for investigations, where the ILO is particularly pointing on this topic. So you would recommend then that, and I would assume it's for all bases, that there be an entirely separate, like a rethinking, I guess, of this idea of stewardship entirely. So where do you think, like, how do we start that? How do we?
We've already tried to change this. So when the program started in 2005, we're able to look at how the system fell apart, because guess what? The federal government left us actually a breadcrumb trail. The Auditor General came out with a report in 2012 stating that with budget cuts and lack of positions, they knew that the safety of their people was at risk. Why? Because preventative safety didn't matter, because we had less positions, we had less money, we're doing everything. We're all doing 3 full-time jobs with one person. This isn't a D&D issue. This is a reality issue of time. But, sorry, I got off topic. And then, how did...
It was talking about the ILO and that...
Oh,
yeah.
ILO is very much, because I would like to ask you, during COVID, if we don't recognize occupational illness, Health Canada is a department they cannot talk out. Who's paying for the cancer treatments of service-related occupational illness? Is that through Health Canada during a medical emergency? If we do not have ILO, how am I going to retire? Did you know the reality is I will be a few years short of really retiring well, based on the time I'm going to have to retire or have work accommodations that probably will not be given to me after this? We have to support people, because then they go and Service Canada. We are spending the money. The money has already been spent on all of our veterans. It is being spent out of the wrong pocket. And I'm going to tell you something. I'm an invisible demographic, and so is Dave. What happens is If you are in and you are unhealthy, you usually stay in, flip to a public service role, and you're sick at the beginning. We see people with smaller illnesses. You are not reaching I can't say it, soldier qualifications. What that means is you were, sorry, my dad.
Universality of service.
Yes, that's exactly. So we are releasing members before we get their data. Remember, we have CAF data? I do not exist. Do you know the service managers of the Legion have now figured out that they have to never put cancer? Cancer is under the disability index. It is not under the actual one you get through for occupational illness. So what is happening is they're putting it in per symptom. But I'm going to tell you, we have RCMP now that I'm doing VAC claims on the side for in the evening that are thinking occupational illness because they have, well, okay, sorry.
To Ms. Manson, as you can see, colleagues, our time is almost expired, but I still want to get in another round. If we're tight, and we won't lose the room too quickly, we could do 2 minutes. So 2 minutes, Mr. Tolmie, and then 2 minutes over here.
Thank you, Chair, and understanding we're compressed for time here. My understanding is base commanders have a legal obligation to report contaminated sites, and that there's things like fix apps, that they're the custodians of the base. We want to go from contaminated sites to prevention and looking after, the next generation, as you talked about. What's your perspective of that? What should be implemented to be able to close the gaps between the different organizations and the reporting?
We have to have people that are educated in the roles that they're going in for. You cannot expect a D&D flight surgeon or doctor to have the expertise they require with occupational illness. We need to be transparent. If we do not have funding, we need to get resourceful. We're talking about protected properties. Do you know the majority of the stuff I can tell that's protected is way lower than unprotected? The issues is security doesn't matter. We can bring in other people, but we have to bring in Health Canada.
So you're saying that the expertise on base right now is not there?
No. Bases managed real property up until 2016, and it was pulled and gone to ADMIE. ADMIE took over, and there was 2 audits, one done in 2018 and one done in 2022.
Just for clarification, we might need what ADMIE stands for.
Assistant Deputy Minister of Infrastructure and Environment.
I just want that on the record so that.
And Environment falls underneath them, and they were both here together that day. And they had a lot of information.
Okay, thank you.
But we need more expertise.
Okay, thank you.
Thank you. Ms. Lalonde, 2 minutes, please.
Thank you very much. I want to say, first of all, thank you for our 3 witnesses today who came in front of this committee, and I certainly, I think we all can attest how emotional it is for you, and some of you were nervous, and I would say you did very, very well. So I commend you for this. I thank you for your services. With the little bit of time leaving, I would like to hear from our 3 witnesses actually about key recommendation that you would like to see us as part of this study, please. So I would like, Mr. Chair, maybe the 3 witnesses to say a few words to close.
For all 3 to get it in a minute and a half. How about we start with Ms. Zimmerman and go to Mr. Hovington if we have time?
Transparency of history. We know for a fact, why did I pull 20 years of contamination ATIs that were already completed? It's because federal government doesn't change, we just get smaller. So what ends up happening is we follow the same things. So what we need to do is we need to go through what happened in Shannon, because there's a lot of new information out there, and what's happened with the Senate committee regarding Gagetown, because this is what this is about, are all of these stories put together. Why was I told to leave this Moose Jaw by union? That is a big question. Why do I not have union representation? That is a very big question. I haven't heard from them in months. We have a situation that D&T is too close to themselves, and there's too many people that know a little bit. No one knew what's happened in history. No one had enough that we were ever guilty of anything. but we're scared that our positions are going to be cut and we're going to be totally blamed based on historical stuff. So historical stuff, transparency, and ILO and Veterans Affairs, and we will start moving forward out of this mess.
Thank you, Ms. Lalonde. 1 minute. Mr. Simard.
Merci.
Thank you. I find the testimony not only upsetting, but highly concerning. I can't hide that. What about the process that you have to follow to have an occupational disease recognized? Could you table this with the committee? I think it could be relevant for us to understand the various steps that are necessary. I imagine that you have to meet with a doctor to start with, but there are probably several different steps to be able to demonstrate that the exposure to contaminants led to your occupational disease. I don't want to be intrusive, but I wonder whether the three witnesses could send us information regarding the steps that they had to take to have their occupational disease recognized.
For occupational disease, it's something that's a specialty, and I want you to know that I am living in Saskatchewan. That means I don't have doctors, but I also don't have the information for WCB and VAC. My husband and I had a very nice savings. It is gone. To be able for me to proceed with this, because I had to know from a doctor, a specialized doctor with visual impairment and neurological conditions, that they felt the same with me, that is toxic related. I had to spend my own money on hotels. On hotels, so I could come here today with facts. I'm a facts person. I'm a data person. I like policies and I like pulling them apart and seeing how they work. But I'm going to tell you something. It's very hard to physically have the money, and I'm lucky that I was in the age demographic I am. If somebody younger was sick, they couldn't get this assistance.
Thank you, Mr. Smart. 1 minute, Ms. Madison.
We've been told several times that there's a great deal of openness and information out in the public. Were any of the witnesses told when you started to work or during your course of time of working on this highly toxic site that it was highly toxic?
No. I'm also getting, I know the two people. Never. I also have gone back to safety officers on base until the time the program started, and not one of them was informed until recently about the program. So when they saw civilians getting sick, general safety did not even know to tell them to report. I've contacted people from multiple bases because now my phone rings off the hook all night long, and I take messages with people with questions, and none of them were disclosed, and they're all across the country.
Sorry, the other witnesses, Mr. Havington or Ms. Puth?
Yeah, like I've been there since 1996 and never been told otherwise. We use a lot of PFAS foam between 96 and 98 until the government shut us down not to have any fires there. And then, foam is very bad for your health. We all know that. The previous board there discussed that at length. So, yeah, as you can tell, I'm sick from it. So, thank you for listening.
Our building is also built on top of the foam, just to let you know, with 1 foot of dirt taken out in 1992.
Mr. Tolney, 2 minutes.
Oh, you've given me another minute?
Two.
Oh, another 2 minutes. Oh, okay. I was ready to pack up. And okay, so tell me a little bit more about Building 143.
Building 143 was built in 1992. In 1982, I have talked to some retired members that caught a hold of other people that had seen environmental doing sampling around that area. Yes, we don't know what PFAS is, but we also know that area was, they had fuel to start the fires. It's the hydrocarbons. Yes, PFAS is just as big, but I'm going to tell you, D&D is going to tell you about PFAS. Sorry.
I'm just going to, there's a thought that's just come into my head. One of the things that we heard was that there's living lists. So buildings that have been knocked down, that may have been contaminated sites. Are you aware of the living lists? Have you been able to access those?
So there is a way, and I'm not going to tell you how to access protected B buildings and measurements and years built. I cannot find out any criteria on the actual contaminants, but I want you to remember D&D was the one making the lists.
Okay, but
So
what
they
I'm asking is based on what they're saying is that there's living lists that people can access.
No, the living list is the unprotected properties, but it is just for the contaminants they found between 1990 and 1993 when they did the cross-Canada environmental assessment for D&D.
So protected buildings are...
Protected buildings are still within the PSPC and Treasury Board world, but what happens is we deem them protected for security. It's very interesting at what they're deeming as protected because I see those buildings now coming down without the proper stuff. So if you work there, you will not be able to ever get a map. So environmental assessments, Kentville RCMP is the perfect example.
Okay, thank you.
Ms. Lalonde.
Thank you very much. Mr. Overington, you worked as a firefighter, and we've heard numerous times the significance of PFAS and what it meant. Could you maybe for this committee, as you are going forward, do you have any suggestions of recommendation of other type of material or other more, I don't know if I could say newer form of, ways of better protecting yourself and others that are having to do the training and still using some of the material for your work?
Yes, ma'am. The CFF and Forces Fire Marshal's Office have come up with a lot of new guidelines. We went from C8 foam from the 80s and 90s to C6. And now they're going to go to probably a C3, which is not going to be good as what the C6 is for sure, and hasn't been approved. That time will tell where we're going to go and be guided by them. That's pretty well, but yeah, PFAS and PFOS is where we used to train in Moose Jaw from building 143. It's about 150 meters. And we used to dump all kinds of waste fuel, flammable liquids in there, and just lighting from just about every evenings and on the weekends fully. So it's highly contaminated probably for 40, 50 years of using that site, which is, like I said, 150 meters from the building 143. And that's why we're so concerned with our health.
Thank you very much.
Caused by that.
And I'm just going to close by saying I had the privilege of going to Moose Jaw this summer. And Mrs. Zimmerman, you mentioned about the human people who are on base and every day working. So I want to commend every single person, CAF and DND and civilians who are doing extraordinary work there. So thank you again for joining us today.
Thank you.
They are the best of the best. They're amazing.
Unfortunately, that does bring some very compelling testimony to an end. Colleagues, what we've heard in previous hours is not reconcilable with what we've heard this hour. So we are going to have a rethink, I think, a rethink of what, how we shape this study. So I think you, Ms. Zimmerman, Ms. Bleward, and Mr. Hovington, I think you can take some comfort that you've been impactful on the committee. And I thank you for your willingness to appear, and thank you for the risks that you are willing to take. And insofar as this committee has anything to say about mitigation of risk, I think it's fair to say that we would all stand with you. So,
thank you, Mr. Chairman.
Yes.
Could we ask the witnesses that if they suffer any remuneration or employment changes as a result of this testimony today, that they report it to our committee.
That was a little bit more direct than what I was saying. Yes.
I'm going to be honest because I'm already at loss at everything. I went from being a really great employee that's gotten coins and certificates, and my boss is all really great promotions. But I'm going to tell you something. I have never been so treated so poorly, and same with Shauna and Dave. Shauna's had to take time off of work just for the fact, why have I stayed? My neurologist asked, why are you on a contamination site? I need a job. I need a public servant position. You have these people there. I'm not going to go back to a great job. My doctor I talked to this afternoon, because I'll be open with my condition, I haven't slept in 2 months. I'm not allowed to work on this. I'm not here under vacation leave. I'm supposed to have paid leave here. I'm using every ounce and leave without pay to talk to you today and make sure I can sit and look into your face, and so you realize I'm a human being. But I need you to understand, I might have to come off for a few weeks, and I was terrified. If I come off for a few weeks, they're going to kick me out and I won't get information. But this is the problem you have. Where do I go as a public servant? I don't even have a union. I'm telling you, the vice president of my union sits on the environmental board as a rep. They are all D&D employees. We all are worried for our jobs and the economy we are. Sorry, sir.
No.
But thank you. But we need assistance, please.
Well, I am truly sorry to bring this meeting to a close, but again, thank you for your courage, all of you. So with that, we're adjourned.